Welcome, and thank you everyone for joining us today. I'm Andrew Barrett, a new program officer with the Healthy Food, Healthy Lives initiative here at the New York Health Foundation. Our overarching goal for the initiative is to connect New Yorkers with the food they need to thrive, and we currently focus on 4 strategies. Supporting equitable food systems planning and capacity building around the state, maximizing nutrition benefit programs, supporting healthier, culturally responsive food purchasing in public institutions, and promoting food as medicine interventions. Before we get started, just a few housekeeping items. We will be recording this webinar, and a recap with the link to the recording and any other materials will be circulated afterwards. Video and audio are disabled for attendees, but we do invite you to use the chat box throughout the event to share your questions. After the presentation and discussion, we'll respond to as many questions as we can. And finally, we have a closed captioning feature available, which you should be able to select at the bottom of your screen. So with that, let's get going. Thank you again for joining us today to discuss food access and policy in New York State. Earlier this month, the New York Health Foundation released a data brief examining household trends in food insufficiency in the state from May 2020 to October 2023. Since the onset of the pandemic, the U.S. Census Household Pulse Survey has tracked the social and economic impact of emergent issues on U.S. households, and they've reported the findings on a near real-time basis. Conducted bi-weekly, the survey includes questions related to physical and mental health and food insufficiency, which is defined as a household sometimes or often not having enough to eat in the previous 7 days. So today we'll use that data brief as a jumping off point for discussion. Our speakers will provide some of the top line takeaways, delve into some of the policies and on the ground realities of food access across the state, and highlight challenges as well as opportunities to address them. I'm pleased to welcome our panelists today, and we're honored to have them join us. Amelia Cobbs is a policy and research associate here at the New York Health Foundation. Ora Kemp is a senior policy advisor for the New York City Mayor's Office of Food Policy, and Whitley Hasty is a benefits navigation coordinator with FoodLink in Rochester. I'll first turn it over to Amelia to share more about the brief, and then we'll follow that with a Q&A with all of our panelists.
Great, thank you, Andrew. Appreciate the introduction. So as Andrew said, I am Amelia. I am the Policy and Research Associate at New York Health, and I'm going to share some of the key findings from our research on food insufficiency in New York State. So Andrew gave us a great introduction on our work, so I'm going to quickly give some highlights here. We're interested in this research because of the extensive evidence linking hunger and health. For example, New York Health's Food and Health Survey in 2022 found that food insecure New Yorkers were twice as likely to report poor health than those who are food secure. So food insufficiency is a shorter and more severe version of food insecurity, which is the definition that people usually hear. And it's defined as when a household sometimes or often has not had enough to eat in the past week. As Andrew mentioned, New York Health has followed the survey as well as different trends and policies affecting New Yorkers' food access over the past few years. I'm going to share some of the policies on a high level which have affected food insufficiency since the pandemic began. Our brief has an interactive monthly timeline on food insufficiency for New Yorkers, including for households with and without children. It also is aligned with the beginning and ending of these pandemic-era policies, which are related to food access. The link to the brief should be shared in the chat soon. As people experienced limited food access due to the COVID-19 pandemic, several policies to increase access were implemented in 2020 and 2021. And some examples include the federal waivers allowing for free school food for all students and emergency allotments for those participating in SNAP, the Supplemental Nutrition Assistance Program. However, as restrictions were lifted and the threat of COVID-19 became less severe, many of these safety net programs were rolled back, such as the ending of the free school food for all students and those emergency allotments, which were ended in 2023. I encourage anyone who's interested in exploring these data at a more granular level and also at different time points to review the timeline, which is in our brief. Again, here we're looking at kind of a bird's eye view to see how these programs ramped up in 2020 and 2021, but almost all have ended by 2023. So looking at the annual rates in food insufficiency, we see a recent rise in food insufficiency in 2023 compared to 2022. And this was where 1 in 10 New Yorkers experienced food insufficiency last year, which is nearly as high as in 2020. A noticeable dip in food insufficiency was in 2021, and that is aligned with those state and federal policies, which were to support food access and economic relief for all of these households. However, it has again risen in 2022 and last year, along with the ending of those previously mentioned safety net programs. We examined the data by households with and without children, and the annual rates show that each year, households with children were more likely to experience food insufficiency than households without. And in 2023, more than 1 in 8 households with children experienced food insufficiency. We, of course, examined the data by race and ethnicity, and last year, food insufficiency rose for Black and Hispanic or Latino households for the second year, and it was 3 times the rate compared to white New Yorkers, creating the largest disparities by race and ethnicity since the survey began. We also looked at income groups, and last year, food insufficiency also rose for all income levels except for the highest income earners. We again see the largest disparities in food insufficiency between the lowest and the highest income earners in 2023. And about 1 in 3 New Yorkers with household income less than $25,000 per year reported food insufficiency last year. So based off of these findings, which show this increase in food insufficiency, along with the end of these safety net programs, which we previously highlighted, we have shared some policy recommendations for New York. As we see families with children consistently having higher food insufficiency, New York State can enact free healthy school meals for all students, as well as successfully launch the summer EBT program for children in order to support families' food access. The other important finding is the widening of disparities by race, ethnicity, and income. To mitigate this, New York State can expand outreach and work on timely enrollment for nutrition benefit programs like SNAP and WIC, as well as ensure that emergency food programs are adequately funded. You can see more in our research and recommendations in our brief, which has been shared with you in the chat. So thank you for your time, and I'm excited to get the perspective of our other panelists.
Great. Thank you so much, Amelia, for that review of the data. Now we're going to transition to our Q&A with Ora and Whitley. We have a few questions to get things started, and then we'll be pulling your questions from the chat. So let's begin with introductions. Or if you don't mind starting us off, just please introduce yourself. Tell us about your journey in food access work and kind of what you're doing in your current role.
Yeah, happy to. Good afternoon, everybody. My name is Ora Kemp. I serve as Senior Policy Advisor with the New York City Mayor's Office of Food Policy. I'm very excited to be here for this conversation today, coming to you straight from the Boogie Down Bronx, the ancestral land of the Lenape and Wappinger tribes. Initially, when I got into my studies, I was very interested in the magic of food. I grew up in a house with a lot of women who knew how to throw down in the kitchen. And we had a lot of people living in a very small space, and we did not have a lot of money. So the kitchen was often also the place that we went for a lot of our healing. That's the place where I first discovered that an iodine deficiency causes people to experience goiters, which is something that my grandmother struggled with a lot when I was younger. And I knew every time that goiter popped up on her neck that it meant we would be eating cucumbers sprinkled in salt as our snack for the entire week until it went away. But the magic of realizing that this small little thing of salt had such a direct visual impact on her health, I was really interested in discovering why that was and why we were not kind of embodied with those understandings of the power of food throughout our education system. So when I got into my college studies, I was really interested in becoming a dietitian. And there was a course called Food Medication Interactions where we were being taught how to modify someone's diet to accommodate the medications that they were being prescribed. And I was like, no, I don't want to work with people once they're already on prescription. I want to work with them before. I want to try and prevent the prescriptions from being needed in the first place. And they were like, well, you don't want to be a dietitian, then you want to study public health, which is a completely different field from what it is that I thought I was going to go into. With that transition, I ended up realizing that the upstream approaches that were needed for helping to alleviate a lot of our chronic diseases, to change the foodscape within our communities, and to provide more equitable access to food was really geared towards this idea of like social stability. Like, what do people need in order to be able to contribute and thrive? So I ended up going through my undergraduate studies in nutrition and food sciences with a focus on public health approaches. I went on to do my master's in public health with a focus on community health education, and then jumped right into my PhD in food studies. As I was going through my PhD work, I found myself in these environments where we were trying to really control all possible variables and saying, if we just change this one thing about how someone lives, like how does that impact them? But I knew that people didn't live these one-track lives. So I wanted to get a deeper understanding of like, what is it like if we approach this from a full person, you know, looking at all of the things that someone needs in order to get to a point of stability. And so I started working in community nutrition. I was with New York Common Pantry for about 6 years, started as a nutrition educator, just teaching people about the power of food, and then moving up to lead our nutrition education and food equity teams. So really looking at not just the individual level skills and abilities that someone needs to make their best possible health decisions, but also what needs to be within the environment and what needs to be within our structures to also facilitate that support. Through that work, I was able to connect some really great people, and I realized that really where I can have the greatest impact is driving forward equitable policy that is centered around food as a right and being able to create systems and structures that support and align with that belief. So now my work at the mayor's office allows me to look at things from a citywide, statewide, and even a national lens and saying, what can we do to help drive forward equity work to ensure that everybody is eating? That's a little bit about me. I'll pass it on over to Whitley.
Thank you. Hi, everyone. My name is Whitley Hasty. I live in Rochester, New York. Actually grew up in a Montour Falls, Watkins Glen, downstate region. And much like Aura had described, food has always been a way that, you know, people connect. For me, it's you know, the kitchen is the most used room in our home as well. I grew up, my mother and 3 of my siblings, her, you know, being, letting us know how to shop with programs like WIC and SNAP. So I'm very familiar with how they work. I actually went to school for environmental science and ecology and RIT. And I just love being out in the community and seeing how, you know, the network, and even though I wasn't in food access work or even thinking about that in college, I loved seeing the network of community resources and how, you know, so much depends on our ability to have empathy towards one another. I'm fortunate now that in the position that I have, I get to use my lived experience to kind of break down barriers where individuals and families are facing an inability to understand or navigate or utilize programs that can help alleviate the rise in poverty and food insecurity that we're all facing. Excuse me. So I work for FoodLink. We're a regional food bank in upstate New York. We serve about 10 counties. And my work as a benefit navigator now has helped to expand the lens that I look through these issues with. I have 2 children. They're 8 and 4 now. This is my last year receiving WIC, and I always say that's bittersweet because I connect with moms and dads and families every day just by telling them, I know what it's like to, use these programs and still work my butt off. So yeah, without rambling too much here, I was actually fortunate enough to be a part of Hunger Free America a couple of years ago after giving the opportunity to do WIC outreach here in Rochester, New York. My favorite aspect of the work that I do is the advocacy portion. I was invited to speak in front of an agricultural subcommittee in the Senate, and I guess I just loved, hearing how impactful the participant experience can be when maybe policies are being made, because I think a lot of people feel like their voices aren't heard when decisions are made to enact or change policies around food landscaping and not just New York but around the country. And so I am here to learn as well from all of the experts we have here as far as the data is concerned, but also to kind of bring a perspective of what families are really saying in my day-to-day work and the community facing work that I'm fortunate enough to do every day. So thanks for inviting me.
Great, thank you both for that background and those intros. So, thinking about this data, like numbers are numbers, and it's not sort of doesn't always feel real to folks, right? So just kind of what stands out to both of you, and how would you say it reflects or maybe doesn't reflect the reality of kind of what you're seeing on the ground in your communities and the work that you're doing?
So what I will say that I think your brief definitely touches on this, but it's how kind of the compounding challenges that people within specific demographics are experiencing. One of the things that I found to be most telling from your data brief was that the group of people who experienced the greatest increase in food insufficiency in 2023 was persons between the ages of 35 and 64. These are folks that are typically building their families. They're typically also people who have been in the professional space for some time. They're in the prime of their kind of like wealth generating years to experience such harsh kind of instability in their finances to the point where we're experiencing an increase in food insufficiency for that population specifically, I found to be really illuminating and in some cases very troubling. Predominantly because a lot of our programs, specifically our entitlement programs, do not allow for qualifying incomes for that specific range of people. A lot of our qualifying metrics for things like SNAP and WIC are around 200% of poverty, right? Which in New York City is woefully insufficient for what a lot of us need for our basic necessities. A family of 3 to 4 is looking at about $33,000 a year, which is a very low threshold, considering that people all the way up to $100,000 in income were also experiencing these changes in their overall stability when it comes to their food access. So this is something that both, working previously within a food access organization where we are seeing people on a biweekly basis, on average, they would need roughly 2 years worth of services in order to get to a point of stability and eventually upward mobility. 2 years of needing support is not an emergency. That's like a standard part of your access, right? Throughout the pandemic, when we had these blanketed, expansive programs that allowed for everybody to receive it without the additional qualifiers, we saw decreases in child poverty. We saw decreases in child hunger. And post-pandemic, With seeing the effectiveness of those programs, you would almost assume that until we actually got back to a point of more stable employment numbers and more household stability, we would have continued funding those programs at their pandemic levels, if not slightly more, to ensure that there is that continued transition back to a point of stability. Yet we saw instead that those programs were cut. The funding was reduced. Even summer EBT, which was previously pandemic EBT, even that now has different structures, both for getting enrolled into the program as well as who is eligible for those programs. The continuity that's needed within food access programs is something that needs to be sustained over longer periods of time with wider thresholds of who it is that could be eligible for these programs based on where the need exists. If we know that families, with dual incomes that are still underneath $100,000 are in need of support because they're experiencing exacerbated challenges in gaining access to food, we should be adapting our programs and policies to meet where that need is manifesting. There is definitely a push to do a lot of that, and we're collaborating much more between city organizations and statewide teams to ensure that we are streamlining these processes to make it as easy as possible for as many people to utilize the resources that are available. But I would really love to see more collaboration from the federal level down to really support in the expansion of programs to meet where the need is existing today.
Great, thank you so much for sharing all that. Whitley, from your perspective and your work, what really stood out to you here, and how does it reflect what you're doing, or how do you see it in the work?
So I think the thing that stands out the most to me are just like visually seeing the huge drops after, the huge drops in food security, specifically after things that really felt hard in the community. Rochester is ranks nationally for childhood poverty. And I live in the Lyle Otis neighborhood of Rochester, New York, and I do a lot of outreach even like around where we live. And it's very prominent. I mean, a lot of the children even that attend schools that I've helped and we partner with, a lot of the food that they get is only in when they're in school. And so what was the other thing I was going to say? A lot of families that I will help if I'm at like a community event will approach me and say, I've applied, I've been denied, for SNAP, and maybe they went through all the trouble, but it's still not enough, or they're right in that area of income, like, experiencing, they're a family that's in that benefits cliff, and they just don't understand how it could be fair to not be able to get that help. And so working for a food bank, we see the stress of that, right? Donations are also down for all, emergency providers of the food hub. And so, our partners and those that we serve indirectly and directly are all kind of definitely feeling the effects of everything that's just illustrated in this data. There's I try to do what I can. I think that what I'd like to stress is that work like benefit access navigators do, and like NOEPs or anyone out in the community filling in those gaps and meeting people where they're at to combat stigma and application difficulties, that needs to be more publicly funded and more publicly supported, so that there are representatives of all backgrounds and cultures and disparities helping their neighbors in their community, instead of giving folks a pamphlet and telling them where they can go to get food, because I see it from both sides, right? Food banks don't end hunger, soup kitchens don't end hunger. When we combat poverty at its root cause, alleviating poverty, it's I have a lot to say about what government needs to enact in order to fix it, but it's not overnight, and it's absolutely just very interesting to see pre-pandemic levels of funding and in food insecurity and the relationships that they have together. So I see it every single day.
Great. Thank you so much, Whitley, for sharing. Yes, I think the sort of cliff and the data that we see and, just makes it so clear how those sort of, barriers to accessing and renewing benefits and those additional programs really made a difference in folks. So I think our next sort of intro question was kind of, or I think you touched on this a little with respect to your, requirements for receiving benefits and those being reduced during COVID. And Whitley, you just sort of addressed it a little bit, talking about that extra support needed for benefits access and renewal. So just to ask the question more directly, kind of what would you say are currently the biggest challenges, and maybe starting again with Aura, to sort of, or barriers to improving food access? And then in addition, kind of what new or unexpected challenges are you seeing that have emerged?
Yeah, I wanted to circle back to something that Whitley had also touched on, which I think is a really important part of this conversation, both in being able to assess like what has worked previously, as well as where some of our challenges are moving forward. The power of lived expertise cannot be understated. The power of people who can share their stories and amplify the impact of receiving benefits cannot be understated, and being able to express just how valuable of a lifeline these resources are for families, for individuals who are experiencing hunger, and for people working to find stability. To not have access to food is a traumatic experience. And I'm not saying that to just, gas it up as a bigger, it truly is. Like, not having access to your basic resources for survival is a destabilizing experience. And it ripples into everything, because if you're experiencing challenges in hunger, chances are you're already experiencing challenges in stable housing and access to healthcare. These things don't happen in silos. They're all connected through the lived experience of a real human being. And to really anchor the work in that, I think, is so vital. So Whitley, I applaud you, because you are someone who is using your lived expertise to drive forward change in this area, and that is desperately needed. We need more people who have experienced hunger making hunger policy. Like, we need more people who have experienced, being in entitlement programs to be part of the solution of how it is that we're going to adapt those programs to ensure more people are provided with the support that they and their families need. There have been a lot of conferences, both at the national level with the Food Research Action Conference, as well as others that are really looking at like what needs to be done to kind of fill in the gaps that exist. Because the Emergency Food Network, food banks, food pantries, soup kitchens, they do a lot of heavy lifting to kind of put a Band-Aid over the challenges that we're experiencing around food access on a larger scale. One of the things that I saw come up in the chat as well was the question around CEP, so the community eligibility provisions, right? So this is saying essentially, if a school is interested in offering free or reduced lunch programs, as opposed to having each individual child go through the process of applying for those benefits, you would look at the community's access to food and determine whether or not a school can receive that program or have that program offered based on community eligibility, which naturally is going to decrease the amount of stigma that's associated with getting into those programs. It's also going to ensure that everybody has equal access to these resources, as opposed to requiring all these hoops or qualifying metrics in order to get access to food, a basic need. I'm really excited to see that with our state budget this year, universal free meals is fully funded. And that is something that I think for New York is huge, because we've been doing that in the city and we see just how much it impacts overall stability. Now, in summer months, when kids are not in school, before things like expanded pandemic EBT and summer EBT, we saw a drop in overall food security. When we look at effectiveness of funding, either from the federal or state level, so much of it is tied to outcome metrics. Are these dollars going towards addressing the specific challenge that we are trying to mitigate? And, from being in the nonprofit space and working with grants, if you cannot prove effectiveness of your programs, you will not continue being funded as a program. It's a requirement. So when we have success metrics, when we know that a program is effective, when we know it's addressing the root issue that we're trying to get to, we then have an obligation to continue funding those programs. So when we had the cuts to the child tax credit, when we had the rolling back of this blanketed expansion of SNAP benefits, we were going directly against the pieces that we know are vital and necessary to ensure that every dollar going into these programs is being utilized. We as a society think often are like, what is the bare minimum that we can give to people to help them get by? When I wanted to almost transition to a more abundance mindset and saying like, for things like the benefit cliff, if we know that a lot of these programs have a similar qualifying dollar or income or household income level, maybe instead of having them all cut off at the same time, we stagger them, right? So maybe as someone is going through and getting promoted with their job, a $2 increase in their hourly pay doesn't mean that they're losing more in benefits because of that $2 incremental increase. There have been research studies that have shown that people will actually turn down promotions at work because it causes them to lose more in their benefits that have provided them with stability than what they would be making in return with that small incremental increase. The reality is when people are in places of need and are working towards a point of stability, to provide them with resources past the point of when they need it and allow them to be the ones to say, okay, I don't need this anymore, and then they can walk away from that program. That should be the default because it will ensure that people have the support that they need until they get to a point of stability and can then transition to being self-sufficient. I would really love to see in the future more programs that allow us to do that. In the interim, doing things like funding universal school meals across the state, I think is a huge step in the right direction. Our ability to opt in for summer EBT is a step in the right direction. I think there's a lot more that we can do, and there's a lot more that we're looking to do to continue expanding access and providing food stability. But I definitely think that when we know something is effective, when we know it works, we have an obligation to continue funding it until it gets to a point where people are stable enough that they no longer need that resource. It shouldn't be us saying that they can't get it anymore if they still need it. It should be, that ability to be, have your own level of like self-determination to say like, listen, I'm stable enough and I don't need that program anymore.
Sorry about that. I always talk before I'm muting. I would be remiss to mention, since you mentioned, summer meals, it's definitely something that the foundation has been, supporting and funding partners like Hunger Solutions and Community Food Advocates to work on the state level to get that universal meals and, a huge jump with, CEP eligibility and extra funding last year. And, maybe we'll hopefully cross that finish line on universal meals with the budget this year. Back to Whitley, in addition, what do you see? I think there's some, questions popping up in the chat in particular about sort of rural access and transportation. If you're able to speak to that, or what sort of, again, from what you're seeing, kind of have any unexpected challenges, or what do you see as like those biggest challenges or barriers to improving access, in addition to that sort of ongoing support that folks need because of that difficulty in terms of applying and renewing for benefits over and over again?
Right. I appreciate what Oris said. I mean, I think we all agree that when something is successful, we should obviously, maintain an obligation to support it, which is why it was kind of frustrating the last couple of months to see such a debate over whether or not to fully fund WIC for the new expected caseload. And I'm really excited that we've won that. But I guess I know I do see a couple of comments in the chat about rural access. I think what are some of the biggest challenges? I think it's really overlooked, food insecurity in rural areas. I can walk as high as the poverty and food insecurity rates are within the city and the surrounding area where I'm at. I know that I can walk to get a meal if I needed to, if I didn't have a car. But we have right now, I think we have about 42 pop-up pantry locations that we visit, and some of those are once a month. Some of them are not as often as, you know, folks need it to be. It's obviously a temporary solution for families. You know, where in rural food deserts, more, you know, most grocery stores are more than 10 miles from people, and without, you know, any sort of transportation, you can imagine what that feels like. So I love that I work for an organization where people, you know, they hear the name FoodLink. I'm really proud and honored. I just, you know, I have to step back and realize there's, you know, I want to do more all of the time. And the best thing that I could do is continue to strengthen the relationships with the partners that we have so that we can make bigger steps towards filling in the gap. So like, I'm interested to see what opportunities there could be to improve, you know, retail opportunities for farmers and smaller grocers who might still be held to the same standards as larger companies when it comes to accepting WIC and SNAP, or you know, farmers' ability to accept the farmers market nutrition program coupons that are received through WIC. And so what else? I guess one of the biggest things is really the application process too for federal nutritional programs. I know there's been a lot of proposals to combine that. I know it's very complicated, but at the very minimum, there are some states that don't require you to, you know, have like a .gov login in order to do that. You don't know how complicated my job gets, troubleshooting. I mean, I spend most of my time just trying to get people to get into a username and password that they've previously created, you know, years ago. Well, I don't understand why that needs to be so difficult. And I can't explain it for folks because, you know, not working for the state or the county, I'm fortunate enough to tell them, look, I know exactly how this feels. I'm on the same page with you. I'll meet them at the library. We'll go through that. So yeah, application process, you know, and making it easier for smaller retailers who actually would offer healthy options to accept, you know, benefits that people would receive. Because I even know families who receive SNAP, and they're like, I don't really have a way to get to where I need to go to shop. The curbside market, our mobile farmers market, we have about 65, 67 stops throughout the week. And I know we're trying to move away from the, you know, asset-based language of food deserts, but I would like to call the regions in which we're supporting and you know, bringing affordable fresh groceries to it is under-resourced, because it calls out the reality of you know, the landscape. So yeah, those are a couple of things that I could think of.
Could I hop in and just say a couple things in relation to Whitley's point there? The first thing that I wrote down was the power of partnerships to fill the gaps. You know, we in New York City, again, like the challenges between rural and urban are definitely different in nature, but I often see very similar kind of solutions popping up in their different compositions. So the first one being around like, where is the need and how are we meeting it? Car dependency is a huge challenge. Transportation and mobility is a huge challenge, and that's not specific to either of our regions. That is definitely a universal challenge. Time as a commodity and the ability to seek out the resources that you need is definitely another challenge. One of the assessments that we do on an annual basis within the city is called our supply gap analysis. We compile data from multiple sources to both look at how access to food has changed and where the dollars for programs to gain access to food are going, how we're diverting those funds, and how we are collaborating with our food access partners to ensure that as the need migrates, we are also then following with the resources that we have available to try and amplify and utilize as many of those resources as possible for where the need exists. Often, especially within the city, with development naturally comes community migration. So as new buildings go in, as the cost of living increases in certain neighborhoods, there is a community displacement that happens. And when people are within a community for an extended amount of time, the resources that they need to reach stability are built around them into that community. But when a community is displaced because of things like an increase in housing costs, they often do not all migrate then to the same neighborhoods, right? So that group then spreads out, and the resources that have been built over, 5, 10, 20 years to support that community do not have the ability or agility to move to these new neighborhoods where their populations they were serving was going. The supply gap analysis is a great way for us to be able to assess just how people are moving throughout the city and how their need is also changing over time so we can adapt to meet those needs in real time. The other thing that it does is it allows for a lot of food access organizations that are now adopting satellite operations or partnered operations to look at where the need is going and say, let's identify a trusted partner in this community so that we don't have to go in and buy a building and have a brick and mortar for people to go to. Let's collaborate and instead support them in setting up a mobile pantry or a pickup location for people in that community who are experiencing hunger to gain access to those resources from someone that they trust. There are a lot of really great teams who are doing this work, not just in New York City, but across the state. And continuing to kind of build on that, the idea of mutual aid networks, being able to support one another across it. Hunger is not going to be solved by just one organization doing all of the work. It truly is a collaborative effort. And so I think that is a common solution that we're starting to see be supported, not just on the community and advocacy side, but also in the diversity of funding and the flexibility of funding being able to go towards supporting more satellite operations. So that's something that I know that upstate there are a few like farmers market trucks that also do this work where they'll hit up a bunch of different counties and provide them with beautiful, fresh, locally sourced produce in areas that do not have that access built into their environment. The other thing that I wanted to touch on is the need for tech investment. So the streamlining of processes for people to gain access to benefit programs. So the goal ultimately being there's one application, one entry point that people will be able to go into, and any benefit program that is provided by our policies or structures that be would all be accessible through that same exact entry point. So it eliminates the need to be applying for multiple programs every single year, going through the recertification process, one entry point, one access point to get access to everything that you would need in order to find stability. Investments in technology like that are desperately needed. We have the ability to do it, and I think that we're finally getting to the point where we're transitioning to that. Another thing that's happening, especially around summer EBT right now, is a lot of communication and collaboration between our city team, our statewide team that is administering those funds, and the access points that have the most direct connection to the people who will need that service. So working with our public schools to ensure that we're sharing enough information in advance so people know how the process is different this year and what they need to do to prepare. Utilizing the same pandemic EBT card that they were issued in the past as opposed to reissuing a new card every single year. So once the funds are available, they immediately have access to it on the card that they already have in their possession. There are a lot of things that we could do to help streamline this process, and I'm excited to see that we're moving in that direction to try and make it as easy as possible for people to get the support that they need all in one centralized place.
Great, thank you so much. So much there. I'm trying to decide which. I think, first and foremost, I think it's been shouted out in the chat as well. Emergency food isn't a solution to hunger for a lot of reasons. One of those, that time question. If you have emergency food programs that are only accessible at certain hours in certain places, it creates real issues for folks who are, especially the working poor, who are working sometimes multiple jobs at different hours, and you just can't sort of schedule sort of map your day around which emergency food programs are open at different times. I think there was, the Food Link shout out to the curbside markets, trying to create access, hospital and school-based pantries so that folks are, if parents are picking up their children for school, there's a there's an accessible point potentially to access food. Speaking of the sort of the tech investment, I think we do see making it easier to apply for and renew benefits for all the reasons we've kind of talked about would be a really positive next step for anti-poverty programs. So, I think you've touched on it, but just curious, on the state level, but also Mayor Adams, did propose that joint application for safety net programs, SNAP and WIC through my city. Has there been sort of real planning and progress on that effort, or what would you say the city would need to kind of implement that opportunity?
Yeah, so I just want to give a quick shout out as well to my colleague Milagros, who's working overtime right now in the chat to share resources and things from our city team. Shout out to her. I will say that there has been a lot of movement, especially behind the scenes, to determine exactly the best way for us to kind of expedite this process and get things going. We know that right now, even within the statewide team, there's a transition specifically in the financial management platform that's being used with disbursement of things like SNAP funds and WIC funds. One of the big challenges is that transition has to happen to provide us with the capacity to be able to integrate a lot of our systems. So this is kind of like a multi-step process that is underway. One of our, we recognize in the city it's a very diverse population of people. There are a lot of kind of conflicting challenges depending on the community that you belong to or the specific, subgroup that you're a part of. And there are a lot of different stipulations around, who is eligible for which programs, at what percentage, and things of that nature. The need for us to kind of just uniformly provide access, I think, would be kind of the easiest way to go about it. But again, the system that we have in place has been created through historic changes in policy, right? These things happen over time, typically very long and drawn out until they are no longer really effective, and then we transition over to a new system. We are in that process right now of transitioning to a new system, which naturally comes with some growing pains, but it also allows us to identify key areas where we might have had blind spots in the past. So you touched on this, Andrew, around the, specifically looking at the economics of hunger, right? Specifically anti-poverty policy. I think that it's really important that when we're talking about things like food access, we don't forget to talk about things like income inequality, because when you put a paywall between a person and the resources that they need to survive, the money then becomes the metric that we need to amplify, right? Someone's ability to have, economic independence, someone's ability to be able to have financial security, that is then the thing that allows them to open the door to these other resources that they also need. Now, we know that food prices and inflation have greatly impacted people's ability to gain access to food over the last few years post-pandemic. You guys' data brief also touches on this, specifically around looking at the cumulative prices of food increased over the last 3 years by 21%. That's a huge jump in a 3-year period. Additionally, the purchasing power of the dollar has declined by $16. So for every dollar we spend today, it's essentially equivalent to 84 cents. Yet wages have stayed stagnant. So our ability to support people and gaining access to the resources that they need also mean that we need to be thinking about things like, what is the professional environment like for people, and what are we providing as far as training and professional development? How are we equipping people with more skills in order to increase their value within the workforce? What are we doing to support things like working mothers and being able to provide them with stability if they're juggling, household, children, employment? And we know from things like, poverty reports that we've gotten over the last year, the group of people within the city that are most impacted by things like economic shocks are single mothers. So if we know that they're the ones experiencing the most volatility, in my head, and then centering them in every single conversation that I'm having around changes in access to benefits or access to food or equitable income, recognizing that we need to center the people who are experiencing the most challenges. And if you do it for that group, it will have a rippling effect for everyone else. Recognizing where the barriers exist and then providing the support that's needed to stabilize people across the board should be the priority. And we're definitely moving in that direction. I think especially with the mayor's focus on really supporting women in New York City is going to be a huge part of that work, and being able to provide the equity and stability that we need to see long-term for those at highest risk.
Great, thank you so much. And yeah, ultimately, in so many ways, the food challenge is obviously geographic access for a lot of communities, but also just it's an economic question, right? It's how do we have living wages? How do we have the sort of have people with the ability to make the money they need to thrive and survive, especially with inflation and other challenges. I do, speaking to sort of that, we know the SNAP minimum benefit is, $23 in New York and in most states. New Jersey increased the minimum SNAP benefit to $95. And I'll just name, one of our grantees, Equity Advocates, has worked hard on New York considering similar legislation. So just, I don't know, Whitley or either one, would you sort of be willing to talk about kind of what that minimum benefit is, or like what it could be, and that potential impact for families to have that increase from, $23 to, I know 50's been thrown out, but $100 is really, I think, the goal in what advocates have been pushing for. So just, name what that would mean for folks.
Yeah, and I just want to quickly maybe just point out, got really excited last month when I listened to our local county give a presentation on a provision to the social service law recently that allows for a once in a lifetime 6-month earned income disregard period. And that, I mean, obviously that's causing a little bit of an administrative shock right now, but I think it's a really good first step in addressing the benefits cliff so that folks aren't essentially punished for getting new employment that's exciting for the household. It's exciting for single parents, and then they all of a sudden, are kind of feeling the effects of making more money and not being able to feed their household. So that was interesting. So when the pandemic emergency allotments ended, households, I think, saw an average loss of like $150. And when you think about the fastest growing part of the population right now are seniors, and those are most likely the age group and the population that's receiving that minimum benefit amount. And we hear it all the time, but I don't know how some folks feed themselves on that many dollars per day when they're deciding between their prescriptions and food for the rest of their budget for that month. So it would be huge, right? I think New Jersey's they implemented 95 for the minimum. I don't think 100 is too much to ask, right? I mean, as Joel pointed out in the chat, which he's a champion of reiterating, that no matter how much work the emergency food hub system in this country does, and we've really felt it these last couple of years, no matter how much work we do, it's never going to compare to the amount of burden offloaded by federal programs. So I don't think it's too much at all to increase it to $100. I mean, people need dignity back in feeding themselves. And I mean, there's no dignity in getting $23 a month. And that's all that you like. I see it every single day. And some really, really tough conversations, very angry people calling and asking me what I would do if I were them. And I don't know the answer to that. So that would be an amazing first step.
Great. Thank you so much, Whitley. There's so many other things that have popped up in the chat. I do want to name, cultural relevance, for example. I think someone talked about the Muslim community and understanding. I know that, the foundation is invested in the Met Council and others to expand halal and kosher foods access and emergency food programs. I know the city has done a lot of work in school meals and expanding halal and kosher foods in school meals. There's someone lifted up the managed care plans and health insurance and helping fill gaps and the opportunities there to expand the amount and ways that people are able to purchase food through health. And we are also at the foundation looking at that in food as medicine. But I think sadly we're going to need to wrap up these last few minutes. But there will be hopefully opportunities in the future to continue these discussions. So I'm just going to start the closing here. So, thank you, all of you who attended here, added to the chat, added your questions to make this a richer conversation. Thank you, Amelia, Aura, and Whitley for taking your time to speak with us.